Hi, everyone, and welcome. Thank you for joining us for the 2026 Healthy Premium and Wellbeing Bucks webinar. My name is Kelly Kimmery, the Wellness Coordinator for LiveLifeWell, and joining me is Priscilla Fortune from Active Health. We will be walking you through the 2026 Healthy Premium updates and Wellbeing Bucks updates, how you can earn them, and how to make the most of these valued benefits. So we are so glad that you're here and hope you find today's session helpful and informative. Let's go ahead and get started. So what is the Healthy Premium? It's a way to save money on your health insurance. All employees and spouses, if applicable, on a Cone Health medical plan must complete the following activities by September 1st to earn the Healthy Premium rate in 2027. You need to create an Active Health account if you or your spouse do not already have one. Complete the health assessment on the Active Health account, and complete an annual physical. These activities must be completed by September 1st, 2026. Employee and spouse must complete their own requirements on their own account. Spouses cannot complete requirements under the employee's account. Each person must have their own login. If either the employee or the covered spouse does not complete all Healthy Premium requirements, the Healthy Premium discount will not be applied for 2027. So please encourage your spouse to log in, create their account, and complete all required activities as soon as possible to avoid missing the discount. If you have any questions or need help getting started, you can contact the Active Health Member Support. Their number is right there available on your screen, Monday through Friday, 8:30 a.m. to 8:30 p.m. Some important reminders. Your annual physical, it can be completed anytime between January 1st, 2025 and September 1st of 2026. That's a 20-month window. The physicals must be performed by a primary care physician or an OBGYN. We do not accept urgent care physicals. Your physical will show as completed in your Active Health account after the insurance claim information has been received. There's no need to send us any personal information. Now, if you do not see that your physical has been completed within 6 to 8 weeks in your account, please reach out and let us know. It may be because your doctor's office may have coded your annual physical as something different. Your health assessment must be completed between September 2nd of 2025 and September 1st of 2026. So employees and spouses, if applicable, must complete the assessment on your Active Health account, either on a laptop using the website that's listed on your screen or the Active Health mobile app. Once you finish your health assessment, click Submit. This is new this year. So you need to click Submit and you will receive an email. If you do not receive an email that you have completed your health assessment, please go back into your account and make sure you answered all the questions. Maybe you just inadvertently didn't click the Submit button, so make sure you click Submit, and then you should receive an email. Okay, so now we're going to move on to well-being bucks. So what are they? They're getting paid for doing healthy activities. So all employees, regardless if you're full-time, part-time, PRN, if you're benefited or not, are welcome to complete a variety of well-being bucks activities to earn up to $250 a year. The program runs from January 1st to December 31st. Spouses are not eligible for the well-being bucks. It is being paid out quarterly again this year, and that schedule is located on our website. So you now have even more opportunities to earn well-being bucks by participating in the following programs. Cone Health Education classes. You now can complete up to 2 series. Last year it was just 1. In the Boost Your Mental Well-Being categories, you can complete up to 5 series. Last year, again, it was only 1. I'm especially excited to share with you about our healthy habit challenges. This will be offered 4 times per year. You complete a challenge and you can earn well-being bucks once they're completed. A fun and motivating way to build healthy habits throughout the year. So what you need to do is just visit our LiveLifeWell website to view the payout schedule, the upcoming classes, and any challenges that we have available. Once you go to our website, it will look very similar to this. You'll see all the activities you can participate in and how much well-being bucks you can earn. If you go to the far right where the plus sign is, just click on that and we'll have a drop-down menu. It will show you how much you can earn and how you can join that particular activity. Once you have completed it, we are paying them out on a quarterly basis. So quarter 1's payroll date is on your April 23rd paycheck. Quarter 2 is July 30th's paycheck. Quarter 3 is on October 22nd, and quarter 4 is January 28th. You can always visit our website for more details. Just click on the Wellbeing Bucks link at the bottom of the screen. You can click out there, see the payout schedule, click on that, and it will give you these dates. All right, so now I'm going to go ahead and pass it over to Priscilla.
Thank you, Kelly. Hi, everyone.
Sure.
My name is Priscilla Fortune. I am an account executive with Active Health. Today, I am going to walk you through my Active Health platform. I will be using the website, but I just want to let you know that if you are using a mobile app or prefer using the mobile app, the experience will be exactly the same. You will just need to download the Active Health mobile app from your app store by searching for My Active Health Wellness, and you will see the Active app in the blue navy, just as the icon on your screen right now. If this is your first time logging into My Active Health, you go through a registration process to create your account, which is about 8 steps. You may use your mobile number or your email address, and any time during the process, if the system doesn't recognize who you are or doesn't recognize your phone number, please call our member support and they will be glad to assist you. And as Kelly mentioned, if you have a spouse on your medical plan, and if you'd like to earn the Healthy Premium incentive for 2027, your spouse will also need to create their own account using their own phone number or their own email address. And if your spouse encounters any issues with registration or login, please call our member support. I just wanted to let you know that Kelly and Shannon will not be able to assist you with the registration or the login process. So our member support number is your best option to get assistance. So now I am going to share my screen, Kelly, and start the demo. Again, I'm going to use the website. I'm going to start by typing myactivehealth.com/wellbeing. Press enter. And this is the landing page. Again, either the website or the mobile app, the experience will be the same. I will use an email address today for this presentation. I have an email address for a test user. Click continue. I will be receiving a verification code on my phone to the email address that I just entered. And again, it takes 5 to 10 seconds, and here it is. I will enter the verification code. enter continue. And the next step will be to enter not my birthday, the test user birthday, enter continue. And I'm going to be taken to a screen for me to create a passkey. I don't have to create the passkey right now, which I will bypass, but you can create it anytime, any day that you come back to the platform. What will that do is recognize your face. So you don't have to enter an email address or mobile number, get a verification code, enter your birthday. So once you were there and you say passkey, you're going to look at your phone, or if you're doing on the website, integrates with your phone and automatically will log you in. So right now I'm going to just skip this option and I'm going to be taken to the home page. You will know that you've arrived at the home page when you see your name and you have some activities. This is a personalized member experience. Everyone will have listed different type of activities. If you haven't completed your health assessment, it will be listed here. If you chose a pathway, which are different experience that you can go through for finding resources for wellness or well-being and achieving goals every time you come back. You will have those tasks for you listed when you come back to the website. Again, each person will have a different experience as far as the activities that are listed. Up here, you see a heart icon, which is the total number of hearts earned for completing well-being activities. And you have a diamond for number of activities completed towards your healthy premium. Clicking on any of the icons, a rewards page will open up, and you can see for the well-being bucks, this test user earned 1,200 hearts, which translates to $12 towards $250 maximum incentive. Just a simple tip for you. When you see the total number of hearts earned, automatically remove from what you're seeing the 2 zeros, and what's left is your total dollar amount earned. If I had 5,000 hearts, it would have been $50. Simple way, no math needed. For the health pregnancy, if this applies to you and you're participating, you will see your bar increasing, total number of dollars earned, and the total number of hearts accumulated separate from the well-being bucks. And the last one is your healthy premium. Most of you, when you first log in, of course, you have 0/2. Once you complete the health assessment, you will see 1/2. If you complete the physical exam, you will see 2/2 completion. That is your goal, to have completed all the way up to September 1st. And if you have a spouse, your spouse will have to complete the same activities by September 1st. So now I'm going to go back to the home page, and I'm going to take you to the healthy checklist, which is where you're going to find all activities that are available for you to earn incentives. When you come here, if this is showing active, you can scroll down and see all activities, how many hearts, or if it is for a health premium, it's very well identified, and you're going to see all the activities that you can choose from. Remember, healthy habit challenge is new, and this is listed over here, and you can earn $10 healthy habit. You can earn a total of $100. It's $25 per healthy habit completed, one per quarter. Also, I want to show you the family health checklist. This will be an activity just for members who have a spouse in the medical benefits, so that you can keep an eye if your spouse is completing the health assessment, the physical activity. If you click on this activity, it's going to open up, it will say spouse health assessment, and spouse annual physical. If you haven't seen this activity shown 2/2 by June, I encourage you to talk to your spouse because your spouse must complete these activities by September 1st for you to earn your premium discount for next year. Now I'm going to show you how to see the completed activities. You drop down from the show list, click on completed, and this test user has completed physical steps and also the health assessment. So I want to take you to the physical activity, which is something that a lot of the Cone Health members like to participate in and earn incentives. So when you come to the trackers on top of the page and the mobile app, you will see a half circle icon. You click on it, this page is expanded. You can click on show more trackers and you have a full list of trackers available to you. However, we will concentrate on steps and exercise minutes because it gives you an incentive. We'll click on steps. If you're manually entering your steps, it's very simple. You click on add today's date. I'm going to say, I'm going to enter my steps. I'm going to save. I'm confirmed that this is accurate and my steps are showing up. Now, if you're entering manually, if you don't have a device, you must come to the website once a week because the website will allow you to enter today and go back 6 days. If I click on week and go into the table, the week started today. So if I go back last week into the table, you'll see that I only have steps for the 9th and the 15th, right? But if I want to add, let's say for the 14th that I did not add, I forgot to add, I can click on add steps, click on 14th. I'm going to enter my steps and I'm going to save, confirm. And when I go back to the table last week, I will see my steps entered. It's very simple, but remember, come back once a week to the website or the mobile app to enter your exercise minutes or your steps so that you can earn the incentives for your efforts that you're doing. Now, if you have a device, if you have a Fitbit, a Garmin, an Apple Watch, you can click on Manage Devices and you see a list of devices and even apps that you can connect with. You may be asking yourself, what is the health app for my Apple Watch? The website version of My Active Health does not have a connection with your Apple Watch health app. You can only connect the health app from your Apple phone to the My Active Health app. So if you download our app, you will go to the trackers and you see an option for you to connect your health app with My Active Health app. But since I am on the website version, it's not showing. But you have other devices that will connect from website to website, which they are listed here. Once again, if you have questions about how to connect, in how to sync, please call our member support number. This is what our team is here for, is to assist you with all the steps, all the activities that you have in this program, so you don't experience anything that any issues, or if you're not seeing your incentives. So we're here to assist you all the way. Just keep that phone number as a contact for easy access. Now I am going to close out of here. I'm going to show you the Explore page, which the Explore page will give you over 12,000 pieces of content related to health and well-being. You will find via audio, videos, articles, recipes, wonderful recipes, but also if you're interested in earning incentives for the recorded webinars, you can come to the Explore section, click on webinars, and you will see a list of recording that you can watch and complete. Now, you may be saying, I don't have an hour to watch this webinar. You don't have to do the whole thing at once. You can pause, and when you come back, you're going to pick up where you left. So there is an opportunity here for you to earn $15 per webinar, up to 10 webinars per year. The last section I would like to show you is the profile section. Here you find your health score. So the health score is it's a compilation of your medical claims, pharmaceutical claims, how you answer the health assessment. All this information goes into an algorithm and gives you a score. If your score is low at the moment, it's because there is opportunity for you to improve. I'll give you an example. If I am over 50 and my claims have never shown a mammogram for the last 5 years, that's an issue, right? I should be doing my preventive. So once I go for my mammogram and the claims arrive, my score will get better. Or if I answer my health assessment saying that I eat fried foods every day, we know it's not healthy. So if I make that modification, right, I participated on the healthy habit challenge, in the nutrition challenge, and I better my my lifestyle, I can come back to the health assessment, update my question to say, I don't eat fried foods, at least not, often, maybe once a quarter, my score will get better. So as you change your lifestyle, remember, your score will start increasing. The goal for all of us is to get to 100. So everyone, including this test user, has room for improvement. Here also, you can get to the health checklist to see what activities are available. Scrolling down, you're going to find the coaching section. Clicking on it, you will hear schedule calls with a coach, to have the 3 calls with either lifestyle or condition coach, and also group coaching sessions. And when you go to the group coaching sessions, you'll see a variety of topics that are available. And also, if you click in each one of them that you're interested in, you will see if they're available in 2 different time zones or different times, one in the morning, in the afternoon, sometimes 4 times, morning, lunchtime, afternoon, and early evening. So I encourage you to come here and check out the available group coaching sessions. These sessions are very informative. And going back, once again, back to the profile page, if I scroll down a little bit more, you'll find your mental health evaluation. If you start this evaluation, you can complete it anytime. It will be 5 questions, easy to answer, but it will tell you how you're feeling. If it happens that it gets you on a day that you're not feeling so good, you will have resources available to you, and it's including either the Con Health EAP, so you have a series of available resources to catch you at that moment when you need support. Now I am going back to my pathway. And again, I encourage you to choose a pathway if you want to be guided in what you need to do when you come to the website. And again, you can change a pathway if you started and didn't like that one. So this website is very flexible and very customizable, personalized to you. So Kelly, now we're going to go back to the presentation. And we have a couple of slides on tips to leave you with, because it is important to remember that when you are tracking your activities, first the health assessment. So the health assessment, remember, you will receive an email address confirmation. If you did not receive the confirmation, I would say, please log back in, check your health assessment, because that's an important activity for you to earn your premium discount. You can also go into the health checklist and look at the completed list to make sure you see the health assessment moved to the completed section. You will also, every time you come back to the website, look at the 2/2. If you're still seeing 1/2, because you have either not completed the health assessment or we haven't received your physical exam. So after 3 months, if the physical exam claims have not come to us, contact us. We will find out what's going on and see how we can get you that completion. The next slide is about the trackers. I just want to reinforce that if you're doing manually your entries, please come back once a week so you can go back 6 days and enter your activities. If you are syncing with a device and for whatever reason, one day your device died while you were running or walking, and you want to add manually another 1,000 steps or whatever, how many steps you know you had, first you need to disconnect your device, enter the missed steps manually, then you connect your device again for the next day to be automatically synced with the website. You cannot do both manually and synced if they're together, right? If you have a device synced, you must disconnect to enter something manually. And the last reminder is every time you earn, if you have 7,500 steps or 20 minutes of activities, you earn $1. And the accumulation of hearts will translate into dollar amount and will be paid out in your quarterly paychecks that Kelly mentioned the dates. That's what I have for you. I hope this presentation was helpful. And again, the member support number is on the screen. Create a contact on your phone, add that phone number because we are here to help you every step of the way.
Great. Thank you so much, Priscilla. Thank you everyone for joining us. Remember, please feel free and reach out if you have any questions about your Active Health account. The number's there on your screen, or feel free to reach out to Live Life Well if you have any questions about the well-being bucks and how you can participate. We're here to help you. Again, every step of the way, like Priscilla said. Thanks again for joining us and have a great rest of your afternoon.